this PowerPoint, we are going to discuss about a case presentation of COVID-19 positive patient. And also we are going to focus particularly the nursing care plan, and we will follow some guidelines. So first of all, the COVID-19 affected the different peoples in a different way. And most infected people will develop mild to moderate illness, and also they recover without hospitalizations. According to the CDC, does not list a different system for data variation or others, because the sign symptom is very vague. So, as I told you, the most common symptoms include fever, dry cough, or tiredness. And less common symptoms like body ache or pain, sore throat, diarrhea, or conjunctivitis, headache, loss of taste or smell, or sometimes difficulty of breathing or shortness of breath. Even sometimes some patients present with chest pain or pressure, also loss of speech or movement. As I told you, the sign symptom is very bad. So next, go here. So nursing care guidelines about the COVID-19. So in this PowerPoint, particularly, we are following organization guidelines. When we deal with the patient in America, we follow two guidelines. One is agency guidelines, other is the national guidelines. So they say all participants that complete these online modules will demonstrate or reinforced the knowledge related to the COVID-19 self-monitoring. Healthcare workers protect and care of the COVID-19 patient, evident through 100% passing grade on a post test. We have one test in this PowerPoint after we finish. If possible, I will take it. So next here, self-monitoring. To protect the patient and co-worker, every hospital or agency employees or resident provider are responsible to self-monitor for the symptoms as well as temperature check each day for sign of positive COVID-19 infection, because being allowed to proceed to work areas. Employee, resident, or provider should not enter any health system facility with a sign and symptom of any illness, including COVID-19. Self-monitoring include monitor of the symptom of illness, include COVID-19, including fever, 8 or above 99.6 degrees Fahrenheit, with chill, cough, shortness of breath, or difficulty of breathing, fatigue, muscle or body ache, headache, new loss of taste or smell, or congestion or runny nose, nausea or vomiting or diarrhea. Here we are talking about the sign and symptom of COVID positive patient. As I told you, the most common symptom, fever, dry cough, and tiredness. And less common symptom included body ache, sore throat, diarrhea, conjunctivitis, headache, or loss of taste, and sometimes patient present with difficulty of breathing, chest pain, loss of speech, or loss of movement. So here's say prevention to exposure. So universal marks use. So we have to follow the universal standard precursor. So marks of all staff or team member went into the effect on March 20, 2022, right? So, and also remain ineffective. So marks are required for all other entering the building regarding of the nature of visit, regardless. So universal goggles or eye shade went into the effect for all team member staff, right, on March 30, 2020 and remain the effect. The eye protection is to be on one for all patient contact within the 6 feet or less. And also continuously educate the patient, family to put their masks when they enter inside the hospital or the agencies or institute. So institute staff enter into the patient room. Also, they should wear the masks. Here showing the masking guidelines. Two types of masks we use, surgical masks and N95 masks. So this one, surgical masks, and this is N95 masks. So each surgical masks, universal masks or masking. So institute will provide surgical masks to all employees for daily use. Any institute, like the hospital SPUH, all patients will be provided surgical masks. The health care worker will ask the patient to put on the masks, or they will assist the patency prior to entering the patient's room. Surgical masks and goggles also should wear. Patient care for all non-COVID also, or even COVID patients. Both cases, we have to follow the universal or standard precursor. Surgical masks are to be used when caring the COVID positive that are not undergoing the aerosol. Also, surgical masks to be worn by all patients, including non-COVID or COVID patients during the transport. Surgical masks are being provided to all patients and all staffs, as well as support the persons accompanying the patients. When we're supposed to wear the N95 masks, N95 masks cover the surgical masks will be worn by the agencies entering to the room in a COVID positive patient that require airborne precursor. So N95 or surgical masks, you can put both to prevent the airborne. So it is also the airborne precursor and standard precursor both. So the surgical masks should be discarded after each patient's interaction, and also the HCW may continue to wear N95 or discuss the surgical masks and remove their N95 and don each surgical mask. Now talking N95 masks will be worn by OR team during the surgeries. And also N95 marks will be on in procedure areas performing the aerosols generating procedure for COVID positive patients. Daily N95 marks documentation, right, up to the 5 times in AV levels. N95 respiratory are to be covered with the surgical marks and change between each patient. So if you follow this way, it can protect us, and also we can protect other infected person, uninfected, or we also save us from infected person, and also we can stop to the spreading to the non-infected persons. So next year, nursing assessment. So how we can do the nursing assessment? So they said careful assessment is essential in the evaluation and management of the patients who have a COVID-19, and particularly in those with a fever, acute respiratory illness, and other symptoms of infections. So nursing assessment of this patient should include, like, patient give you the traveling history. So this should be included, I say, right? So physical examination, careful documentation of the patient's signs and symptoms, which may develop 2 to 14 days after exposure to the virus. So the CDC list of the following symptoms of COVID-19, right? So here I want to share something more. So like a patient came and give the history of the traveling. So a detailed traveling history should include travel to other countries, other states or cities with COVID positive cases. Resources such as the Johns Hopkins Coronavirus Resource Center can be helpful in determining the geographical hotspot in United States or even worldwide. So if you go in their Johns Hopkins Coronavirus Resources website, you will get geographical hotspot areas before traveling. So according to the CDC, most common symptom: fever, cough, dyspnea, headache, fatigue, myalgia means muscle pain, sore throat, or new loss of smell, we called anosmia, or taste. Congestion or runny nose, nausea or vomiting, and diarrhea. Not every patient with COVID-19 experience all of these symptoms, right? In fact, some patient, around 78% COVID-19 patient had a fever. And some of the studies said 57% patient report cough, and 31% patient report they had a suffered fatigueness, right? And 25% patient had lost their sense of smell, and 23% patient lost their sense of taste. So if you go this journal, you will get more information about nursing assessment. Here we are going the specimen collection and guidelines. Because we are healthcare provider, we are RN. Sometimes we have directly contact with the patient to collect the specimen. So this is 2021 respiratory sessions. All patients for admission will have COVID-19 test performed, right, as per this agency, SPUS. It is the one of the hospital. They publish this report. COVID-19 guidelines they follow. When multiple tests are ordered, the order for specimen collection is follow. First one, perform nasopharyngeal swab for COVID-19. Then perform nasal swab. Second, if the flu test or RSV virus test is ordered, staff must wear appropriate personal protective equipment during the specimen collections, like N95 respirator, covered by surgical masks, gown, gloves, also eye protections. All COVID specimen must be double bagged individually. Only one specimen per double bag. Lab order requesting the slip must be adherence to the outside of the double bag, not placed in the bag. Next go the nursing diagnosis. A nursing diagnosis provides the clinical judgment about the patient's experience and responses to potential coronavirus infections. Nursing diagnosis for the patient with COVID-19 can include possible exposure to the virus that causes COVID-19. Second, patient's level of knowledge about the transmission of COVID-19, fever, infection, impaired breathing pattern, impaired oxygenations, impaired social being, and also anxiety associated with unknown etiology of the disease. So what next? So now, nursing care planning and goals. Establish the nursing care plan goal can help to improve the patient's outcome and decrease the transmission of COVID-19. The major nursing care planning goals for COVID-19 may include, like, establish the goals and intervention, assessing the altered skin integrity, risks, fatigue, impaired comfort, gas exchange, nutritional needs, and also nausea. Preventing the spread of coronavirus infection to the patients of the family members, communities, and healthcare providers. Also reducing the fever, restoring the normal respiratory pattern, also erasing the anxiety, which is relatively common in COVID-19 patients, with a combination of an anxiolytics medication, and therefore that include relaxation technique, breathing exercise, and also encouragement. The nursing intervention. Before to go nursing intervention, let me explain a little bit more. So COVID-19 most commonly spread between the peoples who are in close contact through the respiratory droplet or small particles produced when an infected person coughing, talks, or breathing. So the growing evidence show that the droplet can remain suspended in the air and travel distance beyond 6 feet. According to the CDC, they said 6 feet. So when we contact with the patient, it is good to keep the distance 6 feet. If we need to serve the patient less than 6 feet, always we have to follow universal or standard precursor or airborne precursor. And particularly indoor environment will poor ventilation increase the risk of transmission. So to prevent the infection and to slow the transmission of COVID-19, we should follow some rules and regulations, right? So they said the nursing intervention based on assessment data. Nursing intervention for COVID-19 should focus monitoring the vital sign, maintain the respiratory function, managing hyperthermia, and reducing transmission. First of all, monitor the vital sign. Particular temperature and respiratory rate as fever and dyspnea are common symptoms of COVID-19. But it is also keep in mind before give the service to the patient, always wash your hand regularly with the soap and water and clean them with alcohol-based hand rub. Also, cover your mouth and nose with the mask when in public setting or around others. We maintain at least 6 feet distance between you and people coughing or sneezing. Also, avoid the touching your face when you're dealing with the patients. Also, we will cover mouth and nose when coughing or sneezing. If you or anybody suspected COVID positive, request them to stay home if they feel unwell, right? Very important. Next, when you're dealing with the patients, we monitor the oxygen saturations. Normal oxygen saturation is measured with the pulse oximetry should be 94 or higher. The patients with severe COVID-19 symptom can develop hypoxia with values dropping low enough to warrant supplemental oxygen. Also consider proning if not medical contraindicated. So prone positions. So manage the fever. So use appropriate therapy for hypothermia, including adjusting room temperature, eliminating excrete or clothing or cover, using cooling mattresses, applying the cold pack to measure blood vessels, starting or increasing intravenous fluid is allowed. Admin antibiotics medication is prescribed and also readying oxygen therapy in events of respiratory problems resulting from metabolic demand for oxygen during a fever. Maintaining respiratory isolation. So isolation room should be well marked with limited access. All who enter the restricted access room should use personal protective equipment such as masks and gown. Enforce strictly hand hygiene to reduce or prevent the transmission of coronavirus. Patients should wash hands after coughing, or should all who enter or leave the room. Provide information, educate the patients and patient's family member of the transmission of COVID-19. The test of diagnose the disease and disease process or possible complication also benefit the prone positions. So When a patient is diagnosed or if oxygen level go down, we request them to prone positions, and we will discuss what are the advantages of prone position. Means patient lie down on their abdomen, where to protect oneself and one's family from COVID, right, or coronavirus. So now here talking prone positions for non-incubated patient guidelines. So you see the picture. This is the prone positions. So first of all, that designed clinical areas, all in patients area caring for COVID-19. So for patients with hypoxia, there are many physiological benefit to the prone positions, as opposed of the supine. So this include better matching of pulmonary perfusion to ventilations, better recruitment of defense area of the lungs, and improve arterial oxygenations. In addition, there is evidence that the prone positions result in a more homogeneous distributions of stress in lungs, and thus can prevent patients with hypoxemia from developing the lung respiratory failure. Prone positions is extensively used in ICU to treat intubated patients with a hypoxemic respiratory failure, but the benefit above should accrue to the non-incubated patients as well. For this reason, patient admitted with hypoxemia should be encouraged to adopt the prone positions, where the practical or prone positioning may be used as a rescue therapy in patients with a escalating oxygen needs. This document serves to inform clinical about the prone positionings of non-incubated hypoxemic patients. So contraindicated. So when are not allowing or request the patient for lie down on their abdomen or prone. So if patient have a spinal instabilities, if patient have a facial or pelvic fracture, if patient have a open chest or unstable chest wall, or relatively contraindicated, if patient has a delirium, confusion, inability to independently change the positions, or recent nausea and vomiting, even advanced pregnancies. So if my patient have it, what are the equipment always gather beside a patient, like pillow, supplementary oxygen, or dressing to protect the pressure point. Also, continue oxygen monitoring is important. Next, here we can compare and contrast what are the importance and nursing action and special consideration. Nursing action and special consideration. So the nursing action, first of all, assessment for mobility or mental status, evaluate for absolute or relative contraindications. Also monitor for the patients, like EKG leads should remain on anterior chest wall for continuous monitoring. Also, separate, oxygen prone should be placed to the patient of not already in use. So saturation of oxygen concentration is important to monitor and always be prepared to supply the oxygen. Timing. On admission, the patients experiencing respiratory symptoms or requiring supplemental oxygen should receive an initial 1-hour period of prone positions. EKG lead should remain on anterior chest wall. In the prone position, the patient should lie on his or her stomach, also supported by their arms and pillow in such a manner that oxygen supply tubing is unobstructed. Pillows may be placed under the hip or under the legs. After initial 1-hour period, the patient can reposition themselves to supine, but should not educate on the use of the prone position or encouraging to adopt the prone position as often as tolerate or able. The goal should be for patients to be in a prone positions more often than not while patient is in bed. Now, special considerations. So prone, prior to them being encouraged to adopt the prone position, the patient should be assessed for ability to independent change positions in bed. To minimize the interruptions during the prone positioning, patients should consider comfort strategies such as using the bedroom, having the call bell, using the bathroom, and having the call bell within the reach. So whatever we do, always keep the documentation, like patient saturation of oxygen or oxygen device, and also document the response to our in prone positions. Also consider lead placement, encouraging that the lead are not placed on potential pressure points. Also encouraging the patient to be mindful of discomfort due to the pressure and adjust themselves as needed. What next? Prone positions as a rescue therapy. So I said prone position is good for their health. Patient who develop increasing the oxygen need is at the risk for respiratory failure. So it is important to give them oxygen. If patient is in the supine position and it is safe to do so, also place the patient in prone positions. If patient is stabilized, also reassess and continue with medical team after 1 hour. Also, sometimes patient need to transfer ICU. Documentation at the time of events, documentation in EMR. EMR stands for electronic medical record. Also, liter in minute for oxygen, oxygen device, respiratory rate, and saturation of oxygen. Prone position as a rescue therapy should not be used as a replacement for ICU or transfer or intubations or calling RRT. Therefore, it is important to involve the medical team before attempting the prone position as a rescue therapy. So now here showing educate your patient on the importance of prone positions. First of all, here few question and answer for patient education. What is prone positions? It means placing the patient on their stomach, and there is evidence that it helps the COVID-19 positive patient because it allowed them to more easy breath. How does prone position help the patient? Prone positioning improve oxygen level or will help you breathe more comfortably or may prevent you from going on a breathing machine or ventilators. Improve the informations. Call for assistance if you are experiencing increased shortness of breath or returning of face up position if you are experiencing shortness of breath or discomfort. Utilize music or television as a distraction. Next, what are the goals? To be on position for at least 1 hour as many times as possible in the day. Now let me talk about the nursing evaluation. So evaluation helps to the nurse to determine if they have met their goals. Also evidence for meeting the nursing goals for COVID-19 might include the patient successfully prevented the spread of infection to the family or the community or healthcare staffs. The patients learned more about COVID-19 and its management. The patients had improved the body temperature level or restoration of the normal breathing pattern, normal oxygenations, and also reduce the anxieties. Here the documentation guidelines. The documentation is always important. Documentation guidelines for COVID-19 patients include individual assessment or reassessment findings, include any external factor affecting the patient's illness, interaction, or nature for social exchanges or specific patient's behavior. Cultural and religious belief expresses by the patient, and we have to respect it, whatever my belief or their beliefs. Also, patient expectations, care plan, teaching plan, response to the nursing intervention, educations, information, and nursing action performed. Next go, the communications with the family and caregiver. So after finish all of the nursing process or nursing planning or intervention, we will communicate with the family and caregiver. Establish the scheduled time for communication with the family or caregiver. Communication should be for medical update as well, connecting the patients and families, or FaceTime for family caregiver communication or phone call. So it is encouraging the patients to survive, because mental counseling or mental strength also has an impact over the health. So other nursing care considerations for COVID-19 positive patients. So standard or consolidation time for medication administration, we always follows the standard procedure. Clustered care for minimize the time in room in order to reduce the risks of exposure. Also avoid nebulized medications in COVID-19 patients. EKG or ECG, electrocardiograph monitoring protocol for hydroxychloroquine or azithromycin. It is very important to monitor by EKG. IV pump outside the patient room or extended IV tubing and medication that should not be given by extended tubing like insulin. Patient barcode of on IV pole for safe, right? So recognize your patient and not do any kind of error. Also establish the proning teams or also FaceTime or family caregiver communications and safety concern. Consider the utilizing camera for continuous observations. So this is the few information we share about a case of COVID positive patients.